I'll be sure to share the recording and any materials, links, information with the mailing list after today's session. And I think without further ado, I will hand it over to Tammy Amsbach with the University for Center and Excellence in Disabilities with the University of Iowa, or the UCED, and Tori Keith with the Center for Excellence in Behavioral Health. They're going to talk to you today about the CEBEH as well as IPS and what's going on with individual placement and supports in the state since last year. So Tammy and Tori, thank you so much for being here today, and I'll hand it over to you.
Thank you. We can start our slides out. Perfect. Okay, Tori, you're up.
Yes, thank you. Well, good afternoon, everybody. So my name is Tori Keith, and I'm the program manager with the Center of Excellence for Behavioral Health. The center was formed in April of 2022 under sponsorship from HHS, or the Iowa Department of Health and Human Services, to provide training, technical assistance, and fidelity monitoring for entities responsible for developing and implementing evidence-based practices, or EBPs, for individuals with serious mental illness, a serious emotional disturbance, and/or a co-occurring condition here in Iowa. So our current evidence-based practices of focus are assertive community treatment, or ACT, individual placement and support, or IPS, and permanent supportive housing, or PSH, as determined by HHS. Now, just real quick, ACT is, for those who don't know, is a program of comprehensive outpatient services that are provided in the community for individuals with a serious persistent mental illness, with the intent of decreasing or eliminating any of these symptoms that they have, and rehabilitating the individual into their community. So for IPS, Tammy will dive into that here shortly. And then for permanent supportive housing is honestly exactly how it sounds. It's defined as voluntary flexible supports that help individuals with psychiatric disabilities choose, get, and keep housing that is decent, safe, affordable, and is integrated into their community. Tenants would also have access to an array of services that help them keep their housing. So moving on to the next slide, I just wanted to spend a little bit of time on just evidence-based practices as a whole, as they do play just such an important role in what we think of our continuity or continuum of care. So evidence-based practices, or EBPs, have been emerging for many years, really taking off in late 80s, 90s, early 2000s, but they continue to be implemented across the country, having experts continually evaluating systems and addressing barriers in the delivery of evidence-based practices. So EBPs work to combine science, client values and preferences, and clinical expertise with recovery, meaning that people who even have the most severe or most serious mental conditions have potential for recovery in the sense of returning to a functional and meaningful life. EBPs are built on standardized, well-tested interventions based on, randomized controlled trials, really getting a little sciencey here, with more than one research group, but not having that bias. It's really focused on outcome measures that are objective and meaningful. So, many evidence-based practices do have common features, including shared decision-making, client choice, living in the community, and maintaining the client's desired quality of life. While there's still a lot of work to be done in the world of evidence-based practices in terms of making them diverse, making EBPs equitable and inclusive, another just barriers with fidelity scales, that are in use now, being valid. And so we continue to, here in Iowa and just across the country, see what is called, policy without research system. And so, where do we go from here? And, the key here is that we as practitioners, we as a system continue to empower recipients of care and the caregivers rather than the industry. And that is what IPS does, what these other evidence-based practices that are within our focus do, is really empowering and informing recipients of care, and how we are delivering these services should be based on what people who are getting the services want and need, and what their caregivers working with them understand to be helpful within the guidelines of the EBP rather than the industry. And so, like I said, IPS is a really great example of how some of these barriers with EBPs have been overcome. Really historically kind of seen this science to system gap, but hoping to be making steps in decreasing that gap a little bit. So Tammy again will talk about this here in Iowa, but we've used the research with IPS to implement policies. We've used the research with IPS to implement payment structure to really make this a sustainable evidence-based practice here in the state. And so, with that, Tammy, I will go ahead and pass things over to you. Just talk about IPS here in Iowa.
Well, thank you so much, Tori. And it has been a very eventful year with the Center of Excellence and all these evidence-based practices, as well as the growth and development of the IPS service in Iowa over the past several years. This, I want to just give credit for this presentation. We have used parts of it in a kickoff of the Center of Excellence in Behavioral Health, and several of the slides related to IPS, some of you may have seen before. We've talked about this in various forums, and I see some people on this call who may have heard some of this before, but it is so exciting, it bears repeating. I see some of our site providers, actually our IPS providers on the call. So welcome, guys, and feel free to add value here as I go on. So thanks. Basically, IPS is an evidence-based practice. It's the only one that has been researched and validated for adults with serious mental illness. It works in rural and urban areas with some differences, but it's been researched in those areas. There is a large variety of populations that there's some evidence for with IPS, and it's all over the world, actually. The United States, it's in 26 states here, and around the world in the countries that are listed there. It's interesting about the basis for IPS is that there are 60 to 70% of people with serious mental illness want to work. Okay, so, and then the next level is only about 15% of those people are employed in community-based jobs. And from there, only 2 to 3% have access to the IPS services, which is, one of the reasons that we have a big focus on that. We want to serve individuals with all sorts of, with any kind of a disability or a challenge with an evidence-based practice. And so there's a lot of room to grow here, and we are working really hard to grow it in Iowa. So next slide. Okay, so work as a part of recovery. Well, it's pretty well known that adults, and it's an expectation of adults in our society to work. And a lot of our identities come from our jobs or careers or, what we do for a living. So that is a real reason to work. And when you are facing a disability or a mental illness, that is just heightened. The decreased independence on mental health services and increased socialization and involvement in the communities. In fact, clients with substance abuse who become employed often reduce or quit altogether because of their job responsibilities. And I guess the bottom line is that employment is considered as a method for improving recovery outcomes and intervention for those who are in mental health treatment. So let's see if I covered all of the things on here that are important, but you can read this slide. Yeah, a couple of the other things about this, it is evidence is becoming researched for criminal justice involved individuals with other presenting problems like PSTD, autism, even intellectual disabilities. I'm trying to think of some of the populations, youth, and other veterans. There's all kinds of research, but for to become an evidence-based practice for that, it works. The concepts work for people. The research is based on serious mental illness, but it transcends the application, and the implications can transcend that. So next slide. Okay, this is we're trying to show this all the time when we talk about employment in Iowa. Iowa's Employment First Vision has been around for a while. It was really sort of codified in about 2012, and a lot of work has been done that. Jess mentioned the Employment First group that was started out of one of the ODEP projects early on and has gone through renditions. The IC Coalition has supported it, as well as it's been a focus of all of our work in improving community-based employment for people with disabilities. So IPS fits right into that because it is employment in the community. Let's see. Looking at my notes to cover anything else here. Okay, next slide. I'm going to go through some of the operating tenets about IPS for the next few slides. Employment specialists. This is integrated services. So employment specialists involved in IPS collaborate with voc rehab and with mental health clinicians, and with regular meetings to talk about clients who are working on employment goals or who are interested in employment goals. And the integrated services is a real big key with that, because as all of us, talk about our client-centered activities and our mission within each of those areas of employment, voc rehab, and mental health treatment, it all comes together when you work together as a team on a person's issues with a person's goals in mind. The partnership is crucial when we work to support clients and ensure information sharing among teams, and it also helps with the services to support the therapies that are involved in the person's recovery. Next slide. So this is your classic three-legged stool. I know most of you on this group have seen this before, but the three-legged stool is partnerships and integrated services between vocational rehabilitation, Medicaid, and the MCOs that fund the services and activities through the milestones, the milestone payment system we have in Iowa. The community employment services of individuals who are trained in the model of delivering IPS services to their clients, and the mental health service providers that work together with the other team members to provide symptom management and other types of collaboration with the individual and the team towards the employment outcome for the client. Next slide. Okay, so this timeline you've seen before of IPS services in Iowa, but we started, we talked about IPS for a long time before that, and the state level MHDS had applied for some SAMHSA work and stuff like that. But we really started up with 2 pilots in 2018, worked through in developing those and working with some baseline fidelity reviews in 2019. 20 and 21 were some pandemic years, and we all kind of look back on that. It's so recent and yet so far away in our minds, at least mine. In 2021, Iowa applied for and received an Aspire Technical Assistance Grant. And Aspire, which I wrote down what it stands for this time because I always have to do that. It is Advancing State Policy Integration for Recovery and Employment. And it might be one of the more easy to say and understand acronyms that the ODEP projects have had out. The first one was Employment First State Leadership Mentoring Program, or EFPLMC, or I don't know. It was that long one. We all remember that, right? But anyway, this is an ODEP sponsored technical assistance grant that provides us with subject matter experts to help us implement new IPS sites. And with that, in 2021, we have 3 we call it early adopter sites that were started in 2001 and 2002. And so, I'm sorry, 2022. See, I'm living in the past. And we now have 5 sites operating in the state. Just recently in December, starting in January 2023, we have the second round of Aspire sites with the goal of getting 4 new sites in the state between now and August of 2024. So that's where we are with the timeline. Next slide. And this slide shows where we have those 5 teams around Iowa. And we have covered 23 of the 99 counties with an IPS team. There is one in far northwestern Iowa, sort of north central Iowa, and 3 clustered in southeastern Iowa. And so you can see from this slide the counties that are covered by those. It's Hope Haven Incorporated in Rock Valley, Iowa, 43 North Iowa out of Mason City, the Robert Young Center, serving counties Jackson, Clinton, Cedar, and Muscatine. Vera French Transitions Program is in Scott County, Davenport area, and Hope Haven Area Development Center in Burlington, serving Washington, Louisa, Jefferson, Henry, and Des Moines and Lee counties. So it's our geographic coverage right now. And as I said, we have been awarded the second round of the Aspire Technical Assistance project. And we have out right now a notice to recruit up to 4 new sites. We'd certainly like to see those sites covering other geographic areas around the state so that we can get some services for IPS available in southwestern and central and northeastern Iowa. So kind of that swath that is all gray there on this map. We'd sure love to see applicants. That opportunity is out right now. We are looking for applications by the end of February. And I think many of you might have been on a webinar last week that talked about that application and went over some details about what we're looking for in those provider sites. Next slide. Okay, so I'm going to go over some of there is several tenets of IPS that I'm going to talk about here, because these are the things that were part of the research and make it, when these are implemented to Fidelity, this is what makes the outcomes of the IPS service so positive. So the first 2 on this slide, 0 exclusion. And so what this kind of means is if I am in a mental health center or in some kind of a program related to that substance use or something, if I say I want to work, then that's really the only criteria. It's based on customer choice. or consumer choice. People aren't excluded based on a diagnosis, hospitalizations, criminal justice, or work readiness criteria. And so what that means is we don't say, well, you're still actively using, and so you can't go to work until you're clean and sober. If you have to get stabilized before you can start to work. Those kinds of things are not appropriate with using the IPS model. And then integration of teams. We talked about that with our three-legged stool. Employment specialists are members of a mental health team, and all the practitioners work together to help the job seekers achieve their goals and work towards recovery. By having these teams work together, the employment practitioners help the recovery workers see work as a tool for recovery for their clients that may not yet be enrolled in an IPS program. That's an important piece of this model. Next slide. Next to rapid engagement. And sometimes this is said rapid employment. Well, that's nice, but this really doesn't say we want to make sure people get jobs within 30 days, but we want to be engaging them in the work activities to get a job. If I say I want to work, and then I go on some kind of a list to get some kind of an evaluation, and it takes 3 months to get my appointment with somebody to do that, that is not considered rapid engagement. The goal here is to have the client or the job seeker involved with an employer contact within 30 days. So that's when they begin looking for work based on their the next item of individual preference. So based on their individual preference and working with this team, they are seeing possible employers within 30 days. So the next one, individual preference. Not next slide, next point. Sorry. Okay, individual preferences are honored. A comprehensive assessment is done to establish the goals of the person related to job type, distance, hours worked, other job supports they might need, and work environment that they're interested in. And again, this is a team approach. It is based on individual preferences and not on the jobs that are open down the street. Although that's always a balancing act, but the goal is based on individual preferences and not necessarily the pool of readily open jobs. Next slide. So that leads us into the targeted job development based on that individual preference. The employment specialist has worked to develop relationships with community employers and can match those up based on job seekers' preference. The employment specialist is expected to do that through about 6 face-to-face employer contacts every week. And that helps make sure that the employment specialist is aware of what the needs are in the community and what's available, and has developed those relationships so that when a client comes in and wants to work in that environment, like it's possible the employment specialist has worked in that, developed a relationship there before. Someone got a comment? Okay. And as with the Iowa's Employment First policy, the focus is on competitive employment. At least minimum wage, and in the community labor market, these can either be full-time or part-time positions. And folks in this area know that in this work know that part-time positions are common. Jobs that are internships or set-aside jobs only for people with disabilities are not considered competitive employment. And, so they wouldn't be the focus of an IPS program. Next slide. Okay, so we all know about benefits counseling if we work in employment for people with disabilities. Referrals to a certified work incentive planner is really important for clients in this area as they get to know how work and their employment outcomes will impact any public benefits they're on, such as Medicaid or other assistances like housing or food assistance, childcare assistance, and those kinds of things. The opportunities for incentives to work are talked about, and individuals then are, aware of what they're getting into down the road with benefits. And we know, at least from our experiences, that one of the big things about people going to work who have a disability history is losing some of those things that they've relied on that are kind of safety net things. Medicaid is a big one, and there are always new information and new issues that pop up, and we are continually trying to work on those. And so I will just add here that if you are working with individuals in employment and in IPS, and you run into something that impacts their eligibility for those benefits related to work, please let us know those situations, because that's something that we want to make sure and look into the details that relate around that, because we know it's a big one, and it is one of the real concerns of workers and of people providing the service. So, time unlimited supports. This is another area that we have, there's some, some juggling going on in this. Supports provided by IPS staff are designed to be for as long as the job seeker needs them. And many times that is just through the initial phases of getting a job. Our reimbursement system has 4 milestones, and it goes to about 90 days of employment. They work with clients on what needs to be worked with for as long as they need it. And there are, when you're providing a service to a client for as long as they need it, there's issues about how that service is funded, and there's interrelationships between the definitions of long-term job supports and touching base with people and how that is paid for to the providers. It's very important. It's a very important issue. And the IPS model calls for that to be a tenant, time unlimited follow along. And I know that a lot of the providers in Iowa are working to make sure, or to make that make sense and to work, and we're continue to work on improvement in that process. Next slide. Okay. One of the things that helps with that unlimited support is developing natural supports. And again, those of us who work in supported employment for people with disabilities kind of understand how natural supports bring on a safety net for the job seeker and the employment and the employee. Natural supports can be from the employer, from families, from other friends in the community. And as natural supports build up, the job seeker requires less support from an employment specialist. Natural support systems can take the place of an IPS employment specialist, but not necessarily leaving them out of the system. Independence, and the most independence you can gain, is the goal of IPS. And next one is the Fidelity system. Now, as Tori said in the beginning, and as evidence-based practices have been developed, they've been researched with a methodology that says this is what works. And so the Fidelity part of this is looking at how well the programs are operating to these standards of fidelity. And the reason for that is that we want better outcomes. And the evidence-based practice has showed that better outcomes are provided. So a fidelity review isn't a test. It isn't a evaluation. It's a quality improvement opportunity. And the goal is to have a fidelity review once a year for every program, and continuous quality improvement. There are some things in the fidelity review that, that say what could be done to improve your service and your fidelity, and that by sort of by definition should generate better outcomes. I think that that is the whole purpose of a evidence-based practice. The Fidelity review is an intensive thing, and we have a couple people that have had one or are having one this week in our in Iowa. And it's about a 2-day on-site review with lots of interviews, lots of documentation, lots of observations. And then there is a kind of a scoring template and an outcomes report that then cycles back into another quality improvement effort. So next slide, that might be getting close. I wanted to point out a really good resource guide, and I think that we can share a link to this in the chat, or I think share it with the with what Jess sends out. But the IPS resource guide was developed by the Westat IPS Works Center, and out of a grant that they had with the Social Security Administration. And it is really good. It's about 10 pages long, and it's just really basic and informative if you are interested in more background, kind of what I've talked to you about today, and maybe more resources and ideas on IPS. So I think that's it.
Yeah, Tammy,
Last
I'll make
slide.
sure, I'll be sure to share that. Oh, here at the end here, as we wrap up, I'll share that. I'll drop that in the chat for you.
I probably went through that stuff a little fast, and I really wouldn't mind hearing from some of our IPS sites that are on the call, and also any questions.
Yeah, I'll take a pause on the screen share here to pull that link that Tammy was just chatting about. But do any of the sites want to share about kind of what's been happening lately in your neck of the woods around IPS? Or I know a couple folks, Tammy said, had a Fidelity review recently. Just want to like share about how that went or what that looks like. We can certainly unmute and jump in there. Pull that link.
Do you want me to talk?
Yes.
Go ahead, Eva.
So hi, I'm Eva Castillo. I'm the Employment Services Director at Hope Haven in Burlington, Iowa. So yes, Monday and Tuesday of this week, we had our second IPS Fidelity review. They came in July for our baseline, and we scored a 98. So they were back, and I feel confident that we will meet the good Fidelity score of 100 at least this time around, but we won't find out till next week. So I'll have to check in with you all then. But yeah, we started obviously as an early adapter when it kicked off the first round of Aspire. We've grown so much. I think we were not like a typical site. Obviously, we had to kind of learn our own with the mental health piece and creating that team. And I think we've created a great collaboration with our IHHs now, where they're inviting us to their mental health meetings. And so we're talking about employment more and using that as a tool. So they get it now. And I didn't think in our area, I don't think that they used to get it. So we've probably served, I don't know, over 30 individuals in the IPS in our timeline. And we've had, I'm going to look to Mandy, how many placements?
In what time period?
Just the whole over the whole time.
Oh, I think we
12 placements. So 12 people recovery, working, doing well and transitioning out. I think there was a part, Tammy, I think you pointed out about those long-term supports and things like that and job coaching. People can obviously look to be tiered and use those long terms or just utilizing those natural supports within the job too. So, but it's been good. I don't know what anybody has any questions or anything, but I hope that the state fills up more because it really is a great program. And it speaks volumes. I mean, it really does do the work. So, and Tammy, great information. So
Eva, how does it, like, from your perspective, if somebody was considering it, but maybe was worried about how much time or work or like what, you're talking about Fidelity reviews, just any advice or considerations to get
I have
involved
been
and take it on?
I have been receiving a lot of calls from other providers and talking about why we do it, why, what happened. And I think it's just really assessing your community and seeing what your need is. I mean, here in this Southeast Iowa corner, we saw the increase of people in needing that level of support. And so we really just felt like this, I mean, why not? Like, why not, serve that, help that, population of individuals that are obviously underserved and are not getting, with the supports that they need, plus the community where we have, unemployment rate. And, it was just, it's really a win-win for everyone around. So, and for me, I want to move. I mean, I want to keep moving forward with employment first. And I think you have to do that. And I know it's scary and, trying to figure out if it, meets the bottom line and all that. I mean, we've had some great support from our region. So Tammy talked about the three legs, the stool kind of thing. We also have a fourth one in our world because our region supports us. So they, gave us startup funds and then gap funding here and out because they really are invested in it. So, and we've grown. I mean, we started out in our 4-county area and now we're into 6. So we've jumped into Washington and Jefferson with Department of Corrections and now even working with another voc rehab office. So do it. That's what I'm telling you. I don't know. Kayla's on my call. She's my employment specialist, so she may have something to add. But I mean, for us down here, it's working. It's great. We love it. Our community loves it and embraces it, and it's going well. So.
Thanks, Eva. Kayla or Kelly, anybody else want to hop in? Question from Dan.
I'm one of the IPS employment specialists at Hope Haven up in Northwest Iowa.
Hi, Terry.
Hi, I'm Terry.
Hey, hop on in.
I've been full-time with IPS for a year now. We've definitely seen our program grown and continues to grow. Ken is the other full-time specialist right now, but he's hoping to go to part-time, and then we're hiring a full-time person to replace him as he would like to retire. But yeah, definitely a fantastic program, and I've just seen the growth. We've had a lot of success and a lot of talent with especially customized employment. I have found has been really good for different clients. Trying to think, Fidelity seems scary at first, but it's really not that bad. Just to throw out a few things. We have a lot of good support, and like with our IHH people, they've been really wonderful to work with. And one of our main mental health agencies, we're continuing to improve our relationship with them. Some of them, just don't know about our program, so then they're not sure what they're supposed to share with us and how they can help us to support our clients best. So just, providing education to them. And like Rachel, our lead, has been going to do some more training with them just so they understand how we can help them and help our clients together. Does anyone have any questions? Maybe I can answer. I don't know. I'm really excited about new programs starting in our state this year. I think it's going to be a great thing.
Yeah, it is exciting.
Mm-hmm.
Question for all of the IPS providers in the state around, I think I think traditionally we haven't always done a great job of supporting individuals with serious mental illness and employment, all the partners, not within IPS, but just in general in supported employment, that it's just been a little bit harder to demonstrate success by utilizing more traditional approaches. And so I'm curious, for those of you who are offering IPS, you offer an array of employment services. So you have a really good understanding of kind of the different services to meet different individuals' needs. And I'm just curious sort of what your sense is with, given the structure of IPS and sort of the foundations of it, have you really noticed that has made a world of difference when you're working with individuals with serious mental illness? So that's really kind of what we're talking about here, and trying to encourage that expansion of the service across the state. And I'm just, I would love to get any input from you as providers to share sort of your thoughts and experiences around learning and implementing this model in the state.
Well, Amy, I can talk on that. I'm Kelly with 43 North Iowa. So we were one of the first pilot projects that came out in 2018, 2019, something like that. So we've been doing it a while. I would say the big difference is the support of your mental health treatment team that meets on a weekly basis. That is a totally different model than your traditional job development that you provide. And so that is probably one of the big reasons why this model is pretty effective for people with chronic mental health, because the treatment team meets weekly to help move the team forward and the individual forward if they're struggling or not coming to appointments or whatever that might have. And you meet the client where they're at. I think that's the biggest thing. There's no exclusion. And so meeting the client where they're at, and having the other team and support behind that, especially the mental health providers on that team, is helpful. And giving people who are doing the work of doing like job development, those type of things out in the community, help give them some of the guidance of maybe another perspective of how to approach things, of a view you might not have taken before if you didn't have that weekly conversation with a mental health provider.
Thank you, Kathy.
Definitely working with their mental health providers and their IHH, because they don't always tell all of us what's going on in their world. So we can't help them if we don't know. And just different, like I've got, like when we meet with the mental health providers, different tips they can give us to work with different clients and how we can support them better. I think it's been helpful as well. And just sharing. I've also found that sometimes they don't want to meet with their IHH worker, or they don't answer them, but they'll always answer me. So we meet with them together. And honestly, a lot of times it's a lot more effective when we meet together with the client, and we get a lot further in supporting them and in helping them be successful at their job.
Kayla, I see you shaking your head. I'm curious, and not to put you on the spot.
I would agree. No, it's okay. It's okay. Yeah, I would definitely have to agree. Before you may not have had all that communication with, voc rehab and IHH and those things like that. And I feel like for us, it has really, made our relationships with those providers grow stronger. And like just what Terry was saying and what Kelly was saying, just having that constant communication really helps with the outcomes for IPS. So I would most definitely agree with those things.
I'm just going to add one more thing. I think just really important that we're meeting people. What Kelly talked about, meeting people where they're at. Sometimes people don't want to hash their story over and over again. So if you get all the team players in one room at the same time and you talk about it once and you get it laid out and then you move forward. I think that is huge when we talk about any individuals that we serve. Nobody wants to keep talking about it over and over again. Like they're there because they want something, but let's get going and let's move forward with it. So I think for us, we've seen a lot of success when we're talking about, doing those intakes, meeting those people and getting all that going. And so then and it shows you in those IPS training videos that are really old, but stay with them. They'll get that. They get better. So it is, you meet people where they're at. You're not rehashing, the disabilities or the offenses or where they've been and where they haven't been and where they're going. Just hear it once and then move forward.
Thank you, everybody. I want to throw another comment out there. Just in that youth with serious mental illness, one of the areas that we're hoping to work on in the near future and moving forward is not only expanding IPS across the state and serving adults, but also really exploring how we can support youth with mental health issues. And we have a great opportunity right now because of the Department of Education is implementing a new process of evaluating schools and outcomes for all students, but also students with disabilities who fall under IDEA services. And I guess the point of that is that this spring, the districts that were identified in this sort of first round of implementation of this new school evaluation structure, there have been 17 districts that have been identified to work on secondary transition. And part of what we want to do is really bring evidence-based, research-based, effective practices to the schools and the districts in supporting youth with disabilities. And so IPS is one of those models that we hope to not only expand for adults, but really intentionally try to help build capacity to support youth as well. So I just wanted to throw that out there because I think now's a good time in Iowa, to look at this service and figure out how we can make it more available across the state as well as serve a wider population. And the providers who've shared today are amazing and have really invested a lot of blood, sweat, and tears, I think, in the last several years in really expanding these services and maintaining them in what we know has been an incredibly challenging time. So I just want to thank them and thank Tammy and Tori as well. And I just feel like there's only more opportunity as we look forward. So sorry, I'll stop talking now, Jess.
No, thanks for jumping in. Love it. So I think, Tammy, can you remind us again when the application is due for the call for new sites, and we'll be sure to share that information in the email that goes out to folks, and we'll get that out soon because I think that deadline's coming quickly.
It's February 28th is the date for the applications to be in, and it's to Lynn Niblink, who is not on this call, and because they are doing the Fidelity reviews that we're doing this week. And also our trainer Fidelity reviewer is there, or I think she would probably be presenting this today if she was available, but she's doing that, filling that role. And so it's the 28th of February with the review then will happen the first part of March by the Aspire leadership team. And then we'll be starting up new sites starting the end of March, I think is our goal. And we're looking for up to 4 in this round.
All
So.
right. Well, we will be sure to get that out before the week is over then. That additional information, we'll share the slides. I dropped the link again for that IPS guide, that resource guide that Tammy shared there. That's in the chat again, but we'll be sure to put that in the email. So I think if there's not any further questions or comments tied to IPS, I'll just remind you that we come together again in March 9th at 1 p.m. And again, we're on the second Thursday of each month through the end of the year. So that's a bit of a difference, right? We'll go through, instead of the fall, we'll go through the entire year, which I think is exciting. We'll share more information about next month's topic once we've got that hammered out, or those details. But just look for more information coming through the mailing list. And if you're not a part of the mailing list and you would like to be, or you have team members that would like to be, just shoot us an email at the Iowa Coalition for Integration and Employment, and I'll drop that in the chat right now. And so we look forward to seeing you March 9th at 1 p.m. Thank you so much, Tammy and Tori, and IPS implementers and early adopters. Thank you so much for joining us today and sharing your experiences. And we'll see everybody March 9th. Thank you.